Hi, Dr. Mahesha here. Today I am going to show a simple case of L4-5 endoscopic discectomy. This patient presented with left-sided L5 radiculopathy since 3 months. The MRI shows left paracentral disc extrusion at L4, L5 level. Surgery is done under local anesthesia. I am inserting a 18 gauge needle into L4-5 disc space under image control. The entry point is about 12 cm lateral to midline. You can see in the CM pictures that tip of the needle is in the midline in the AP view and posterior 25% of the disc in the lateral view. Once the needle is in place, it is replaced by guide wire, and then we insert a dilator over the guide wire into the disc space. Once we reach the medial pedicle line in AP view, guide wire is removed. Then you look at the lateral view and you can see that the tip of the dilator is touching the posterior border of the disc, and then it is hammered into the posterior 25% of the disc space, and in the AP view I have reached the midline. Then I insert this cannula with the bevel facing towards the head over the dilator into the disc space. And once you reach the disc space, you rotate the cannula so that the bevel is facing up. Then the dilator is removed and endoscope is inserted. We are seeing the endoscopic pictures now. You can see that the extruded fragment has been caught and it is being removed. Now we pull out the cannula to expose the edge of the annulus. You can see that there is epidural space at the top, redundant annulus in the center, and the disc space at the bottom. RF cautery is used to control the bleeding. Then we use this annular cutter to do annulotomy. Here I am using an oblique annular cutter to do the annulotomy. With 3-4 bites of the annular cutter, you can clear this redundant annulus. Once we are done with annulotomy, RF is used to clear the redundant tissues. This makes the surgical field much clearer, and you can see the epidural tissue at the top. A small grasper is used to clear the residual disc, and finally annuloplasty is done using RF. Once surgery is complete, you can see the dural pulsations at the top. You can also see the L5 root, which is lateral to the dural sac. You can see that whole of the disc which was compressing the thecal sac and the root have been completely cleared, and free pulsations of the dural sac is seen. Thank you, and I will see you in my next video on endoscopic discectomy. Bye.